the size of my sample. Yes, those are the things we're going to look at today. Yeah. Let's go to the next slide, which has objectives. Yeah, those are the objectives. Those are the objectives I've just talked about. The three: you must understand sampling and the terms. You must know the sampling method, and then sample size determination and where we can apply sample size determination. Next slide. Yes. The terms we use in sampling, first and foremost, is sampling itself. It is the process of selecting a subset of individuals or items from a larger population. Remember, I've always been giving this example. You have the whole country like Nigeria. You cannot use the whole population. It is like in 80 million. You get it? However, you want to conduct your general research study in the country called Nigeria. So what you do, you have to select a sample that can represent well the population of Nigeria so that you learn on conclusions. Population, that is the entire, of course, individuals. Yeah, in that you're interested in. You get it? The entire population, the entire size of the population in that area, which area you are interested in, or age group, or sex. You get it? You want to do an investigation in a Juba. You get it? You must find out the population of Juba. You understand? Yes. So that's a term that we shall also use. Sample is that subset of the population. You get it? Yeah. That is that portion that you select out of the population happens to be your sample. Then sampling frame. That is the list of all elements in the population from which the sample will be drawn. Yeah. For example, I wanted to do a study among let's say lung cancer cases who come to Juba hospital. You get it? Now, it is always very important for me to at least have a list of these people or a list of their files, their ID number, their lab ID number as they get admitted. You understand? Now, that list, if I have it, for example, if they are 1,000 and I have that list, that happens to be my sampling frame. You understand? Yes, that's why I've said it is the list of elements in the population from which the sample will be drawn. Next slide. The sampling method, it is that technique you use to select the sample from the population. We are going to see various methods: simple random sampling, stratified. We're going to see all of these ones and then understand them very well. How are you going to select your sample? You understand? That is the method. Then convenience sampling, of course, that's also a method. We are going to see it. It's a non-probability sampling method where elements are selected based on availability. We're going to see this method in detail. Don't worry on that. Sample size, of course, it is that number of individuals or items included in the sample. That is the sample size. Yeah. Remember, I said you have the target population. So you have the target population, that is the whole population of that area, the whole population of that age group, the whole population of that particular sex. You understand? However, from that population, I said you're not going to consider the whole area, the whole members in that age group. You will select a certain proportion. So the number of people or participants in that proportion happens to be of sample size. Representativeness, that is the extent to which a sample accurately reflects the characteristics of the population from which it is drawn. I think this one is clear. Some researchers have been biased. I've always talked about bias in research. So a research is biased when you have selected the sample. It cannot represent your population very well. Yes, we know there are millions and millions of people in the area. Yes, and we know that you might not be able to handle 5,000 people, but the 1,000 you're going to handle, can it represent well? We saw when at the beginning that one of the characteristics of research is neutrality. You get it? One of the characteristics of research is neutrality. It should be neutral, whereby it balances very well. You might select 1,000 sample size from your millions population, yet the 1,000 doesn't even have any case of the disease you are investigating. In the end, you report skewed results. You you report results that the prevalence is 2.1%, yet the actual prevalence is like 20 or even 30%. So that is representativeness in sampling. Let's go to the next slide. Probability sampling. So it's a sampling technique where a researcher selects. We're going to see this probability sampling technique and then the non-probability methods. Yeah, we are going to see them in detail. However, at this level, probability sampling and non-probability sampling are the basic two types of sampling in research. I guess you get it. Probability, whereby all members have a chance, equal chance to participate in the study. And then non-probability, members do not have equal chance to participate in the study. Both of these two types of sampling methods have advantages over the other. You understand? Yes. So probability, the sampling technique where a researcher selects a few criteria and chooses members of the population randomly. Yeah. All the members have an equal opportunity to participate in the sample with this selective parameter. I've said that all members have equal chances. That's what we call it probability. You get it? And then under non-probability, the researcher randomly chooses members for research. However, the sampling method is not fixed of a predefined process. This makes it difficult for all elements to have equal opportunities to be included in the sample. We're going to see under their methods. We're going to see the details of these methods under the non-probability schemes, under the probability schemes. We're going to see and then get the difference between the two. And at the end, yesterday I told you that by the end of this week, you shall have come up with a research topic of interest that you must cover. So by today, I guess that by the end of this lecture, someone shall have identified a sampling technique that is going to work for their study. We are healthy professional students. We must be able to identify healthy problems in our societies. That one, I'm sure each one comes from a certain state. We have those ones from Juba and then other states. Okay, let's go to the next slide. The methods. Yeah, under the probability methods, we have simple random sampling, cluster, systematic, and then stratified. We haven't seen the details of these ones in the next slide. Then non-probability, that is convenience. The good thing with these methods is that their names are too direct. Once you read through the method, you just know. You just know which, you just know what it means. You just know how does it arrive at its sample, because that is the goal. How does it arrive at its sample? You get it? Yes. So we have convenience, purposive, snowball, and quarter sampling. All of these sampling techniques are just direct. We're going to understand them more. Let's go to the next slide, and we conquer this. Okay. Simple random sampling as one of the probability sampling methods. This is one of the best probability techniques that helps in saving time and resources. Exactly. Let's see how it is done. It is reliable method of obtaining information where every single member of the population is chosen randomly, nearly by chance. I want you to understand simple random sampling method because it is almost a must to include in your research. At some point, it is hard to avoid it. That is the truth. Sometimes you might have used another method, but you end up in the end integrating simple random sampling into your sampling method that you're going to use. You get it? So put a keen eye on this method and understand it well. Here, each individual has the same probability of being chosen to be part of the sample. Now, in this example, this is when you're going to understand how it is done. In an organization of 500 employees, the human resource team decides on conducting team building activities, and they would likely prefer picking chicks out of a bowl. In this case, each of the 500 employees has an equal opportunity to be selected. Now, sometimes we list all the members. For example, in this study of employees, we can put a list. Of them, for example, on a computer, and then we try to just select randomly. We try to just point at some, just point your finger at the screen of the computer and you arrive at that member, you include in your study. You point at another one, you include in your study. You point at another one, like that, like that, like that. So that's how it is, a simple random sampling method. Sometimes you just go to the village and you're like, whoever I arrive at, I just include in the study. You understand? Sometimes you gather community members for your study, and then you write the cheats. You throw those cheats in a bowl, and each of these members comes and picks a cheat. And perhaps those who pick later are going to be participants of your study, so long as they are ready to take on the next procedure after sampling. That is informed consent. In case they accept to participate in your study, they have understood, they sign an informed consent form. So those ones become members of your study. Let's go to the next slide. I guess members have understood simple random sampling. Cluster sampling. Cluster. Now you're hearing clusters. Yeah. Guess what? Researchers divide the entire population into sections called the clusters, representing the population. Now, clusters identified and included in a sample based on demographic parameters, for example, sex, age, location. Now, if I can give an more example on this, we can say that we're going to arrange clusters in terms of the studies on adults aged 20 to 60 years. So we can form clusters in a way of, let us cluster them in a groups of also, I request you mute kindly. I request you mute your microphone. Okay. I was saying that we can use age clusters in a way of 10 to 20 years, 20 to 30 years. You get it? 30 to 40 years, 40 to 50. This helps all age groups to be included in the study, because if you use the simple random sampling directly, remember all members have equal chance to participate in the study, but there is also a chance that your members who will select perhaps the cheats to be in the study might be based on a certain age group. For example, members who have successfully picked your cheats might have been from 40 to 60. You get it? And now the other ages will be phased out. Yet the study is on adults. The study is on adults aged 20 to 60. Get it? Kindly, Anyama, is it Anyama something? Kindly mute your microphone. Okay, that is good. I was saying that in case you use the simple random sampling directly, it is so easy to forego a certain age group. So the importance of including cluster sampling, of using cluster sampling over simple random sampling, is that you are going to arrange your members into clusters. This increases an opportunity for each age group to participate. Another case is that you might do a simple random sampling, and only those who have been successfully picked at randomly are only women. Yet in your study, it considers both sexes. You understand? So at this level, it is easy. For random sampling, it is easy to forego a certain group. Yet you wanted it in your study. For cluster sampling, I might arrange my study into clusters of age-sex relationship. In a way of, I first arrange into age groups. Now, among these age groups, I further arrange into sexes, whereby I can have 10 to 20 years male, 10 to 20 years female, 20 to 30 years male, 20 to 30 female. This also increases a chance for each of these groups to participate in your study. At least you have a member or two, but let them not be left out. That's now the important. Here, they have given you an example that suppose the government wishes to evaluate the number of immigrants. In that case, they can divide these migrants into clusters based on states. For example, we can have immigrants from Juba, we can have immigrants from Malakal, we can have immigrants from Kwajok, we can have immigrants from Rumek. You get it? So in this will increase the chance of immigrants from all states to try to investigate what they are going through. In other words, if you didn't use clusters, you might find out that your assessment might be based on only immigrants in Juba. You get it, eh? Yet at this level, you want all of them to be considered in your study so that it can be reliable and the results will be representative, will be valid. I think we have discussed the characteristics very much. Almost each lecture we have been talking about characteristics of a good research. You get it, eh? Yes. Let's go to the next slide. So at this level, the survey would be more effective at that level. Okay. Systematic sampling. This is also very good. It is also reliable. How is it done? That is the question. Researchers use this method to choose the sample members of the population at regular intervals. So it requires someone to select a starting point for the sample and the sample size determination that can be repeated at regular intervals. This type of sampling method has a predefined range, hence the sampling technique is the least time consuming. Quote me well. Now, you're going to understand using this example. A researcher intends to collect a systematic sample of 500 people. Now, let's say someone determined their sample size, calculated their sample size, and they are sure they have arrived at 500 people. However, the population they are going to collect from is 5,000. You get it? 50,000. 5,000, yes. Now, he or she numbers each element of the population from 1 to 1,000. You see, this is easily done with a computer. You get it? I can have a list of these members and I number them from 1 to 5,000. You get it? Yes. So long as you can access that data. Remember I talked about basic research, you understand, and then applied research. And I said basic research is like a fundamental. So I can first go to that area, I do a basic research just to find out the residents of that area who are in this age group, who are exposed to this. You understand? And then after getting that list, I assign them numbers. You understand? And then I proceed from basic research to the further stage of research. Now, if I assign them numbers that all of the students of this institution, I assign them numbers from 1 to 5,000. However, I only wish to pick 500 only. What do? And we say the elements from 1 to 5,000, and we will choose every 10th individual. The question is, how did he arrive at the 10th individual? That was by dividing the total population divided by the targeting sample size. So when you divide by 5,000 divided by 500, you get it 10. So you're like, every 10th individual of this study, I'm going to select this individual to participate in my study. I guess now you get it well, eh? Yes. Whereby I can say 10th member come out, 20th member come out, 30th member come out, 40th member come out. You get it? 50th, 110th, 120th. You get it? Now those ones happen to be participants of my study. You get the point, eh? That's how the systematic sampling is done. I can choose to use a second member, but the only question is, how did you arrive at using it too? Did you just say, now I feel like getting it 2, now I feel like getting 3? No. There must be a calculation and how you arrived at saying it 2. If you didn't have that calculation and you just said, now I'm taking every second member just by your choice, meaning you are targeting someone. You already know someone is a victim of this condition and you want for them to be a must to participate in the study. If you just say that by your own, perhaps you might have looked through it and you are aware that this member lies on this position. You get it? That's why we are saying you must avail a calculation that shows that this is the way you arrived at it, that I will select every 50th member. You get it? Let's go to the next slide. Stratified sampling. Stratified, stratified is like layers. Strata. Those are layers. It's like a Latin word, strata. So stratification, arranging in layers. You understand? Yeah. So it is a method which the researcher divides the population into smaller groups. These smaller groups are called strata. I'm repeating, they are called strata. It is like layers into smaller groups that do not overlap but represent the entire population. While sampling, these groups can be organized and then you draw a sample from each group separately. This is almost like a cluster sample. But there's a difference you're going to understand in the example. For example, a researcher looking to analyze the characteristics of people belonging to different annual income divisions will create strata, and I've said the strata, the groups, according to the annual family income. For example, like the one I gave there. And a sample is then taken from each respective income group. Hmm? Yes, clusters usually we base on the, for example, I can say living indicators, living factors, age, sex, location. That's when we can base on to get clusters. You get are they are in a specific location that we get that cluster. You get yes, members there are lame, we get that cluster. Those are living factors. However, there are these other factors that they're not living factors. For example, income sources. Another example is level of education. You get I can say let me arrange them in way of those who stopped at primary level or elementary, those who went to secondary education. You get it. Yes, that is now the difference between stratification and clustering, but they're almost the same. Yeah. Let's go to now the uses, the advantages of probability. Yes. Now, under probability sampling, we have a reduced bias. You have seen that each member has equal opportunity to be a participant of the study. That's why we mean that there is reduced bias. You get it cannot produce skewed results. You get yes, it cannot produce skewed results. And also, you as the investigator, you don't have any intention to harm someone. I've told you, for the example, the other systematic sampling method, it needs you to first provide the calculation. You get it? Yes, not to just say that I wanted a 50 member. No, provide the calculation that this is how I arrived at number 5. You get it? Yes. That's why there is reduced bias. Also, diverse population. It covers the target population is diverse. In other words, it easily represents what you want. You get it? Then also creates an accurate sample size. Remember, to go for this sampling method, you have already predetermined your sample size that you want. You get it? Yes, that's what I mean by creates an accurate sample size. You have already calculated. There is a method. We're going to see this method in this lecture. So you have already calculated it, and it's now what you use in when selecting your sample out. Okay, let's go to now the non-probability methods. Convenience. It's convenience. What you are convenient with, you as the investigator. This method depends on the ease of access to subjects such as admitted patients to a health facility. They are not bad methods, by the way. They are good in their context. Non-probability methods, yes, they don't give all members a chance to participate, but in their context, they are good. Why? Because your research is going to yield something. Under the other probability methods, I told you at some point it is easy to arrive at members who are not even cases of that disease. But for non-probability, someone is aiming at those ones with lung cancer. He will only screen out those ones. You get it? Yes. Someone is aiming at patients admitted to the hospital. He will wait for them at the hospital because he is convenient with the area. He'll wait for them at the hospital, and that's where they will come and he will assess them. You get it? That's why they are advantageous in their context. However much they are not having an equal opportunity for all of the members to participate. You understand? Yes. So convenience is because of the researchers' ease of carrying it out and getting in touch with subjects. I'm repeating, the word convenience came from that. The researcher finds it so easy to arrive at participants because he even knows those ones who are cases. You get it? I already know that this one is an alcoholic. You understand? So I don't find ways. Actually, do you take alcohol? Do you smoke cigarette? No, I already know you're a cigarette smoker. Yeah? So I chose this method because it is convenient for me, and that's why it became a convenient sampling method. You get it? Yes. Researchers have nearly no authority to select the sample elements, and it's purely done based on proximity and not representativeness. I select these members because they are nearer to my facility. You get it? Because I can easily access the village. Because these members come come to my health facility. I'm the one who admits them. Therefore, I find it so easy. I find it convenient to include them in my sample. That's why we have said it doesn't depend on representativeness. We don't say that now we are going to get a group which will represent the state. No, we shall only wait for those who come to the facility. So we are not considering that are they representing? No. I think now the point has reached home. An example is that startups and NGOs usually conduct convenience sampling at a mall to distribute leaflets of upcoming events. That one happens. Or promotional vehicles. They do that by standing at the mall entrance and giving out the pamphlet. Yeah, that was just a rare example, not from the medical field, but I think I've given you a good example from the medical field. Yeah, let's go to the next slide. Judgmental or passive. What is my purpose? My purpose is to assess lung cancer. I will only get those ones who have lung cancer. What is my purpose? My purpose is to assess those ones with mental health problems. I will run restricted to those ones with mental problems. You get it? Yes. Samples are formed at the researcher's discretion. You get it? Excuse me for that. Yes, I was saying that researchers use snow. Sorry, we are on the first. Go the previous slide. Just a bit previous. Yes, judgmental. Yeah, and I was saying that researchers purely consider the purpose of the study. I've given you an example on that. Yes. For instance, when researchers want to understand the thought process of people interested in studying master's degrees, what do they think? You get it? So the selection criteria will be: are you interested in doing masters? Yes, you become a participant. You get it? Yes. Are you interested in doing this? Yes, you become a participant. Do you eat pork every day? Yes, you're a participant. No, you're not included. You get it? Do you do this and do you do physical exercise every day? No, you're not included. Do you do physical exercises? Yes, you get included. You get it? That's what we mean by purposive. So this study is conducted purposely on the cases of the problem being investigated. Let's go to the next slide. Snowball sampling. This method that researchers apply when subjects are difficult to trace, when we find it a bit hard to identify the subjects. We provided a very good example here that is going to help you understand snowballing. HIV/AIDS. You will not announce in the community that all HIV/AIDS patients come for a meeting tomorrow. They will not come because no one wants to be seen that I'm HIV positive. You get it? Yes. There are cases, commercial sex workers. You know commercial sex workers? Yes, the so-called prostitutes. If you announce that tomorrow we have a research on commercial sex workers, come, you will not, of course, have anyone. You understand? Because no one wants to be seen that they are commercial sex workers. Yet, they have very crucial, important research that you can conduct on them. Now, researchers in this case use the snowball theory to track a few categories to interview and derive results. Guess this example. For example, surveys to gather information on HIV, on commercial sex workers. Yes, not many victims will be ready to respond to your questions. You get it? However, researchers can contact people they might know or volunteers associated with the cause to get in touch with the victims and collect information. For example, caretakers for HIV patients, nurses at hospitals. We can ask them, do you know any HIV patient? Yes, I do. Do you have their contact? Yes. Call that person to come to your facility. When they come, we keep them. You get it? But we don't make them to participate. We don't force them to participate in the study. No. What we do, we teach, we tell them everything, and then we ask for their consent. You understand? Yes. When it comes to commercial sex workers, remember these commercial sex workers, they have their areas where they work from, and those areas have bosses. So in case I want to work with them, I'll go to their boss. I will ask them, Do you know any commercial sex worker? They say yes. You have their contacts? Yes. Call them. He calls them. They come. We explain them everything. We ask for their consent. They consent. They become participants of the study. I guess you understand this very well. Eh? That's what we mean by snowball theory. They don't want to be seen by other people. However, if you call them in a secret area, they will come, and not you to call them, but their bosses, their people who have their contacts. You get it? Eh? Yes, no, they have trust. They are trusted people. Like that, like that. Let's go to the last method of the non-probability methods.
Yes, sir. Yes, sir. Go,
Yes,
you,
yes.
my hands is up.
Oh, yes, I hadn't seen it. Yes, please. Carry on. Go on.
You go back to the other slide for snowball.
Okay. Let's go back to snowball. The previous slide.
Yes.
Okay.
Yeah. My question about the concern. And maybe to track them for us. And later on, we consider it as something private. It is no longer private to me because we have already approached different people. I was thinking like if we are to, yeah, I was thinking like if we are to, sorry guys, I was thinking if we are to see other ways of maybe getting such people, for example. Then through their bosses, like okay, for example, in the hospital, we track the HIV patients through the records, through those that are treating them. I think that one doesn't really over
Yes.
to you.
Okay. There are various. Before everything, yesterday we are discussing about research design. You must come up with a research design, you as the investigator, and submit it to the National Council for Science and Technology, which governs research. This is the one to approve that according to your research design presented in your research proposal follows under HIV patients, commercial sex workers. This section is very sensitive in a way that these people don't want. You cannot just call on them and they just come. You get it? Eh? So you might have indicated everything. How shall you keep this information? Even you, will you record their names or you use codes? You must say that I will use codes. I will not even use their names anywhere. Therefore, anyone who will read my research paper will not know that I called on so and so in this study. They will not know because we shall identify our participants with the codes. However, don't worry, in our subsequent lectures, we are going to talk all about confidentiality and privacy and ethics in research. But that was a good question. I guess we can continue, and I guess something was solved.
Thank you so much for your response. I think I'm through with that. That was my concern.
Oh, okay. But thank you so much.
We can proceed.
Oh, okay. Yeah, thank you. It was good. Next slide, please. So the next slide, it is talking about water sampling. Yeah, and in this case, as the sample is formed based on specific attributes, the created sample will have same qualities found in the total population. Yeah, in the case we have a general population, in case we have a general disease in the area, So as you try to obtain that your sample, you obtain it at a quarter level in a way that if the disease is actually in the whole country is coronavirus, but which area is it hitting so much? We identify that it is hitting Juba so much. Then we shall base our sample from Juba at a quarter level, at a quarter system. Check this example. Researchers first divide the population into mutually exclusive subgroups called strata. We talked about this. And then recruit sample units until you reach your quota. These units share specific characteristics determined by you prior to Sudan, South Sudan, and I'll get to the states in South Sudan. Those are the first groups I form. Now, among these states, I divide them into, let's say, parishes. Among parishes, I divide them into subgroups. Six, I will represent whole population. That's what we mean by the quota system. You get it? Yeah. The person presenting actually. Okay. Let's go to the next slide. Let's go to the next slide, which has uses. Yes, uses of non-probability sampling. It makes it easy to create a hypothesis. Yeah, when we are looking at the sample sizes, we're going to understand so much what a hypothesis is. Yes, we're going to understand that so much. However, here researchers use these non-probability methods to create an assumption when limited to no prior information is available. For example, for example, we don't know any prevalence of asthma, any previous prevalence of asthma in our area. You get it? We shall use these non-probability methods to get asthma patients only and investigate on them. However, we can even we can perform these non-probability methods to get prior information on the community before you come to your probability methods. Let me repeat this. I can first use a non-probability method when actually I'm going to use a probability method. However, we don't have prior information on that condition in that area or the neighboring areas. In case you don't have any prior information in the neighboring areas as well, I can say, let me perform a non-probability method. I go by convenience. I first go into the nearest area. I first select out a specific age group. I first investigate on that to obtain just the prior information, just to come up with hypotheses, to come up with assumptions regarding that condition in that area. Then in the end, I employ my probability techniques. That's what we mean by that. However, we're going to understand the hypothesis in the next slide. Then another use is exploratory research. Researchers use this sampling technique widely when conducting qualitative pilot studies or exploratory. We mean explore. Yeah, and it is almost the same as how I've explained the previous point. Explore, we can do pilot studies just to go and get a hint on the area we are going to study. Yes, remember you have some studies that will require to first get some information. For example, cohort studies. We saw these cohort studies yesterday under designs. Yes, these studies, if you're going to study on the children, on the malnutrition among children of 0 to 5 years, and you want to perform a cohort study, you want to follow up these children from their day of birth to when they make their 50th year. If you want to follow up, you must first do a pilot study or an exploratory study. You go into that area, you first know that do we have any pregnant mothers around? When are they expected to give birth? So that you can get a proper time frame for your study. You will find out that such an exploratory study will require you to use a non-probability method. You will go to your health facility and first check how many mothers are coming for antenatal. At what level are they in pregnancy? You get it? Yes. Mr. Nyama, I can see your hand is maintained up. I don't know whether there is still a question or it is just didn't put it down by the other time. But okay. Okay, good now. Budget and time constraint, that's also an advantage under non-probability methods. We don't have these time constraints and budget because these ones limit time on arriving at our samples. You get it? Yes, you just find it, locate a sample of your convenience, then you include those ones in your study. You get it? And also, this such a study doesn't require money because in case I want to do on lung cancer patients, I will just passively go select out the lung cancer patients and investigate on those ones. That's why you have reduced the budget and time constraints. Let's go to the next slide to discuss sample size determination. Good. Sample size determination and the terms used. First and foremost, hypothesis. So in research, this is a specific testable statement of prediction about the relationship between two or more variables. How do I arrive at a prediction regarding a certain condition in that area? One, by using previous studies. You get it? I can use previous studies. Or what something you should mute kindly. Yes, good. I've said that one, how we obtain predictable, or how can we predict? How we can take assumptions. We can use previous studies in the neighboring areas or in the general population. You get it? If I don't have, that's when I will do a non-probability method to get a prediction or an assumption on that area regarding the problem and the investigation. I think that point has reached home. Then you see hypothesis has two things, has a null hypothesis and then an alternative hypothesis. We usually refer to them as H0 and H1. The null hypothesis states that there is no significant difference or there is no significant relationship between variables being studied. Lung cancer and cigarette smoking. Null hypothesis states that lung cancer is not caused by cigarette smoking, or lung cancer is not associated with cigarette smoking. That is the null. The alternative hypothesis proposes that there is a significant difference or there is a significant relationship between the variables and investigation. So researchers seek evidence to support the H1. Researchers make sure that according to previous studies and according to the results of my study, my hypothesis is true. Indeed, cigarette smoking is associated with lung cancer. Indeed, lung cancer is caused by cigarette smoking. This is the aim of a researcher. Before, when you are developing your research proposal, when you go to your supervisor, he will ask you what are the hypotheses of your study. You will say the hypotheses of my study are that lack of physical exercise is associated with development or with incidence of cardiovascular diseases. You understand? Yes. This is like something that you are shown to attain in the end. This is like your prediction in the end. Remember, without a hypothesis, your research is insignificant. Because how shall your research help that community? What is the justification of your research? We are going to understand the parts of the research proposal, and we shall see that each one is very important. So you'll be asked, what are your hypotheses? If you don't have hypotheses, your research has no justification. There's no problem solving. Remember, we said the first step in research, we said it is identifying the problem. So you have identified the problem. So are you just going to leave it hanging there? No. That's why we say you must have an hypothesis. That's something you are shown to achieve in the end. So I guess we have understood the two terms, the null and the alternative. Let's go to the next slide. I've said the null, we are trying to fight against the null. We as researchers, the alternative is what we want to achieve in the end. So considering the power, the probability of rejecting a false null, I guess you get it this time. The probability, the chance at which a false null hypothesis is rejected, detecting an effect when one truly exists. Let me make us understand this very well. Remember, I've said researchers aim at at saying this we want to go against a null hypothesis, the null will say lung cancer is not associated with cigarette smoking. You get it? Now, such a null hypothesis, it is a null. You get it? It is false. You get it? Yes. So, if the chance at which you stand to say that indeed this null hypothesis is null, or indeed this statement is a false statement, that is what we refer to it to as the power. You get it? Yes. Then the margin of error. The margin of error is the range within which the true population parameter is estimated to lie with the level of confidence. We're going to see this confidence level when we look at the calculation. We're going to see the calculation for sample size. But the margin of error, if your margin of error is 5%, that you're like that in case I have an error in the results of this study, in case I have an error in the margins of in the findings of this study, that error will not be beyond 5%. You get it? In case I have an error, that error will not be exceeding 10%. Remember, the maximum permissible error is 10%. That is the maximum we can accept. You understand? Yes, the maximum is 10%. So you can say that I'm sure, I'm confident. You as the investigator, I'm confident that the findings of this study will be true. However, in case there is any error, this error shall not exceed 10%. You understand? Now, the margin of error becomes 10%. Your level of confidence is 90%. I'm repeating. In case you used a 5% margin of error, that I'm sure in case there is an error in the findings of this study, this error will not exceed 5%. You get it? However, if the error does not exceed 5%, then I'm 95% sure that the results of this study are correct. I can say that if I have an error, it will lie on 2%. You get it? Anyama, if I say the margin of error is 2%, what would be your level of confidence? Anyama or Unzima? Anyone can answer that? Someone to answer that? If I say my margin of error is 2%, what would be my level of confidence?
It will be 98.
98. You get it? We're going to see how these two are applied in your calculation. We are going to see them. Thank you for that answer. Confidence level, we have said the probability that the true value of a parameter falls within the calculated interval. Yes, that's what we have just answered. That I'm confident that 98% these findings are true. Okay. Significance level. So the significance level, that is the probability of incorrectly rejecting a true null hypothesis. Significance level. The probability of incorrectly rejecting a true null hypothesis. Yes. The null hypothesis will state that lung cancer is not associated with cigarette smoking. Then you, the investigator, your findings of the study reject. I'm making us understand this, that the null will say that lung cancer is not associated with cigarette smoking. You, the investigator, you find out that lung cancer, you reject it. You reject a true null because the null is true. That lung cancer does not is not it is a null. It's already the null hypothesis. You get, but for you get an opposite result to that. That's what we mean by significance level. So the chance at which you, the investigator, you incorrectly reject a true null hypothesis will produce the chance you have is called the significance level, and the error you produce is called type 1 error. You get it? Yes. So the error, it is just there, incorrectly rejecting a true null hypothesis. Let's go to the next slide. And we finish terms. Yes. Type 2 error, that is a failing to rejecting a false null hypothesis. Yes, that it is what we mean by true or false. whereby it is stated well that indeed this is a null hypothesis. If it is stated well, that is a true null hypothesis. If it is not stated well, that is a false null hypothesis. So if you accept, if you fail to reject, if you don't reject a false null hypothesis, you produce a type 2 error. A cohort, we saw it yesterday, is a group of subjects who share a common characteristic and are studied over time. We saw that yesterday, cohort studies. Then randomization, it is that process of randomly sampling, randomly assigning subjects to different treatment groups to minimize bias. That one, I think it is understandable. Stratification, we have seen it. We arrange them in strata. We divide our population into groups called strata, into levels. Then statistical power analysis, it is that method used to determine the sample size needed to detect an effect of a given size with a specified level of power. We have said that it's a method used to determine the sample size needed to detect an effect of a given size with a specified level of power. So what power means? An effect of the sample size you have selected. I think that one can be hard to understand, but this is like trying to match your sample with the population. With the target population. You try to match your sample with the whole population. That's what we mean by statistical power analysis. Let's go to the next slide. We get the formula. Good. The formula for calculating sample size. That is the formula. You must make sure you understand it. The equation is n being the sample size. N is the sample size. You get it? Yes. Z squared, that is times the P into 1 minus P over E squared. Now, here down, we are saying Z is the level of confidence. I think I've talked about level of confidence. That if I say that my margin of error, which is the E, I think you're seeing that down, that the denominator is E. E is your margin of error. If your margin of error is 2%, a colleague of us answered that your confidence level would be 98%, that I'm confidently sure 98% will be true. You get it? That's what we mean by level of confidence. Then P, but that, however, remember that is a statistical value. Z is a statistical value. We obtain it in logo books. I guess in high school we might have studied about something to do with logo books or statistical books. Yes, the one which have statistics, whereby if I have a 98 confidence level, I can just go into my book and then get a corresponding value to that. We have said the P is the baseline level of indicators or any previous prevalence of the condition. That's what I told you when generating hypotheses. This is where it comes about. When you are generating a hypothesis, you look at the previous studies. You get it? You look at the previous studies related to this problem you are investigating. You get it? If you get the previous studies, they will give you a certain baseline. You get it? That the prevalence of chronic obstructive pulmonary disease is 2%. You get it? And that's what you take. 2%, when you convert it, it becomes 0.02. In case the prevalence was 20%, it becomes 0.2. You get it? Yes, that's the baseline of indicators. Or in case you don't have any previous study, you can go perform a pilot study using your non-probability methods. You get it? Yes, you can go perform a pilot study or an exploratory research study. We saw these terms when we are beginning research methods. We saw these terms. So you can do a pilot study, you get a baseline of indicators. That is in a case there is no previous studies done on the condition you are investigating. In case they are not there, you can just go do a pilot study, get a baseline of indicators that, according to what I've seen, 50% of the individuals have lung cancer, and that becomes the value for P. Let's go to the next slide. We see how we can apply this. Yes. So I tried to put in those values. You see, 1.96 is a statistical value. Statistical in a way that if you have a 95% confidence interval, for example, if you have a 95% confidence interval, yes, meaning 5% becomes your margin of error. You understand? 5% becomes your margin of error. And if you convert 5%, it becomes 0.05. That's why you're seeing in the position of E, I put 0.05. Then, if margin of error is 5%, the confidence interval would be 95%. When you go into the statistical book, it corresponds with 1.96. In case you don't know how to use these statistical books very well, that's another huge module called the biostatistics. But if you don't know how to use them very well, in your research, when calculating sample size, always take 1.96 and then 5% margin of error. I guess you get it. 5% margin of error corresponds to 95% confidence interval, which corresponds to 1.96 as the value of Z. Always just take that, it is acceptable. Then, when it comes to 0.5, it stands for a 50%, which means prevalence. Yes, and 50%, that is 50 over 100, that is 0.5. Yes, in a case you had a previous study and for it said the prevalence is 50%, you get that becomes your previous prevalence. In a case you didn't have a previous study, but you went and did a baseline study to get the baseline of indicators, you did a pilot study, it can show you that members who have that disease are like 50%, and that's what you use here in your calculation. In case you find out that they are like 30%, that's what you use. However, any procedure that you used must be indicated in your research design and hence presented in your research proposal. I repeat, any procedure you use must be well represented in your research design and must be indicated in your research proposal. When we are ending this module, I will give you samples of proposals, research proposals, and you see how they are all indicating the procedure they are using. You get it? I'll share even some of mine. Yes, and you see how I could present my work very well. That any procedure, any step, you must describe it in your research proposal. You get it? Yes. Okay. I guess we are clear there with the substitution of values and why each value is indicated under that. If you, after calculating like that, you must present your final answer as 384 participants. Let's go to the next slide. I put another example. This is another example. I said, in case a researcher is investigating the prevalence of asthma among adults in Juba town. However, the whole prevalence of asthma in South Sudan is 25%. Now, in case you know that the whole prevalence of asthma in South Sudan is 25%, and you want to do an investigation specifically in Juba town, I will use 25% as my baseline of indicators, or I'll use 25 as my value of P. I think you're seeing how I substituted it. I came here, I calculated the value of P as 25%, which gave me 0.25. Then I went into my formula where N equals 1.96. I have talked about 1.96. It corresponds to the 95% confidence interval. And we put that 0.525 in the value of P. You're seeing how I calculated everything there. And I got the value 288. We are just substituting. There's nothing big. We're just substituting, and then you press your calculator. So I put it down and I said, in case there is any expected non-response rate, I think I didn't define this term under the terms. I didn't define this. However, there is always a non-response rate. We have participants in our studies that will accept to participate in your study. However, according to your questions you're asking them, someone is like, I didn't expect these questions. Me, I'm withdrawing from the study. And do they have that right? We shall see under ethics in research, we shall see that they have all these rights to withdraw from your study at any time they want. Therefore, these participants are considered as non-responders. They are considered as participants who didn't give you response. You get it? Usually, we select a non-response rate from the condition being investigated. You get it? That's where we choose this rate from the condition being investigated. For For example, if you're investigating something to do with the, let's say even the cancer, some people are like, I cannot just tell you that I have cancer. What if you just go and talk about to me like that? You get it? Therefore, some people, when you ask them, you might begin your research very well. They give you demographics, they give you everything, but you read on other questions in the questionnaire. You ask them, do you have any type of cancer? For example, cervical cancer. Someone's like, I cannot tell you that. You get it? Therefore, when someone says, I'm even withdrawing from your study, I'm tired. You get it? We consider those ones non-responders. That's what I meant here. That in case there is any expected non-response rate, it is you, the investigator, to expect a non-response rate, and you select this rate according to your problem being investigated. Right? Yes, I've said it can be divided as a factor. It can be divided as a factor. How? For example, the 10% is the rate of non-response. Usually, World Health Organization accepts from 20% non-response. But again, if you expect the whole 20% not to respond, then why would you carry on with such a study? However, like I've told you, the World Health Organization can accept 20% non-response. So long as 80% will accept and they give you the information, yes, they can accept that, World Health Organization. However, I'm also asking you, why would you? I think there is no reason why you would go for a study, why you would investigate a problem whereby 20% of your participants will not give you the information you want. You get it? Such a study will just be wasting your time. However, 10%, if you expect 10% not to give you information, that one is okay. So that's why I used it as an example. So for that case, the value is now divided by 90%. You get it? Non-response is a 10, then response rate is 90. So we divide all through by 90%, and 90% is 0.9. That's what I put under there, that I got the value up 288 and I divided by 0.9, which is 9%, the response rate. And I got 320, and that's what we take as a final sample size. I guess we have understood that. I've told you, you better start working on your research. You better start thinking about it such that we can be moving at the same step. In case there is something that confuses you, you can easily ask on it. It is important. Let's go to the next slide. Yes, proportional calculation of the sample size. This is best for stratification or cluster sampling methods, whereby each cluster or strata takes a sample size depending on its proportion on the total population. You understand from the example I gave. I gave you two tables, the table on the left and the table on the right. The first table, you use it to obtain a proportion which each city or which each town takes from the total. You get it? I have 3 times I want to investigate. I have Juba, I have Malakal, and I have Rumbek. You get it? And that is their corresponding population. Now, and there is the total population. So I calculate and I get the ratio. I give a percentage which each one takes. You get it? Now, if Juba has the highest population, meaning even in my sample size, it will have the highest number of participants. This is very important. Remember, in case population is a factor in your study, therefore, the one which has the highest population stands at the highest risk. You get it? The one in case population is a factor in your study, therefore, the town which has the highest population is the most susceptible. That's why even when considering the sample size selection, you will give it the highest sample size. This is very important because almost every research you will apply it, especially researches on large areas like towns, cities, states, community. I mean, not communities. Communities is a very small area. Districts. You get it? Yes. You'll be applying this method. In table 2, you already have the proportion. and now you want to get which proportion is it taking from my final sample size. Remember, in our previous slide, we arrived at a final sample size of 320. You get it? Therefore, I use the 320 and the proportions to get the sample size target I'm going to get from the respective cities. I guess that one is taken home. The one for proportionality, yeah, it is taken home and it is very important in the research studies. However, this is not the end of everything about sampling and everything that I discussed yesterday. When we come to research methods too, that is to discuss now the real application of research. There I will give you every detail of everything and we shall be recapping on these ones. Just do me a favor, be attentive and understand. In case anyone hasn't, let them watch the video. It will be uploaded on YouTube. Good. Let's go to the next slide. Yeah, here I gave you a reference and how I wish the person who is having these slides can share with other colleagues, because I want all of you to access this stepwise manual. It will simplify your research. Everything is detailed here. It was given by World Health Organization. In case everyone can try to access this manual, you download it as a PDF following that link that I provided. This will ease everything you want to understand about research. Just download it. It will ease your process. That reference. Good. And this marks the end of my lecture for today. And just in case there is any question, a compliment as always, I welcome it. Thank you.